As of tonight, 5 U.S. Olympic athletes have tested positive for COVID-19, either in Tokyo or before leaving for the Games. And at least one other athlete is in quarantine as what's known as a close contact.
But what actually happens when an athlete tests positive? Our Dr. Frank McGeorge is here to explain the protocol and why there will be many difficult decisions that'll have to be made at these Games. Doc?
Yeah, no doubt, Kim and Devin. So Olympic organizers have known from the start that in spite of all the precautions in place, some Olympians are going to test positive for COVID-19. So they've devised a system to try and contain those cases as quickly as possible to frankly limit the spread to other athletes and staff.
What we're seeing is what we expected to see, essentially. You know, if I thought all the tests that we did were going to be negative, then I wouldn't bother doing the tests in the first place.
It's the ultimate race at these Olympic Games, trying to outrun COVID-19. Once clearing quarantine after their arrival, athletes are being tested daily with a saliva test. Anyone who tests positive will immediately be sent to a designated clinic for a nasal swab PCR test. The athlete must remain isolated at the clinic to wait for those results, which take about 3 to 5 hours. If that test is also positive, the athlete will be moved to a designated hotel to be isolated and monitored by medical staff.
We identify them early, we take them apart from other people, and we manage them and look after them. And we look after the contacts.
Athletes are not allowed to return to the Olympic Village to gather their things. Instead, a volunteer will be sent to get anything they need. Positive athletes will not be allowed to compete, and how long they stay isolated will be determined by Japanese health officials. A list of the athletes' close contacts will be created. That's considered to be anyone they were with for at least 15 minutes closer than 1 meter apart without a mask. In the case of a team sport, that may include the entire team. Close contacts will be tested and potentially quarantined. A panel of 8 doctors and 46 advisors will review every close contact and determine on a case-by-case basis who will be allowed to compete. Now, there's actually a 70-page booklet that spells out all these processes and all of the safety rules to the athletes. The International Olympic Committee estimates about 80% of the Olympians have actually been vaccinated, but this daily testing is really designed to pick up on any asymptomatic breakthrough cases like we've already seen happen.
Yeah. So, Dr. McGeorge, that covers the medical. What happens in terms of their spot in the competition?
Well, it's kind of interesting. Athletes who test positive will receive a did not start in the official results. Now, there are specific rules for each sport on what happens to their spot, whether they can be replaced, and for example, if they would still win a medal if they qualified for the final but tested positive before competing in the final. Safe to say, this is probably going to be really complicated at the end.
It really will. Okay. Dr. McGeorge, thank you.